Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined as always by brother Stephen. Welcome in, brother.
Hello. I do feel guilty because it hasn't always been. There have been a few episodes I missed, and a couple that you missed.
Joined as most often by
95% or
All right.
something.
Okay.
It's just weird. That's
Well, some days you're at your old man doctor getting an appointment, so you missed recordings and things like that. How does it feel to be half a century old?
I mean, I guess that's middle age for sure. I mean, our grandfather's 99, so
that's true. Happy birthday, Papa. It is interesting. I was telling Dr. Robinson the other day that we are the same age as Dr. Harris was when we worked for him, which made us both feel old. Like Dr. Harris, like always, if I see him now, I think, well, it's the same age as he was 25 years ago when I worked for him.
Yeah, and I hope that in 25 years I look that good because I saw him Sunday. I saw him Easter, and he looks great. And
right. Looks the same to me. It's like, so maybe he looked really old a long time ago. I don't know.
But that's just throwing somebody under the bus early in this episode.
Well, I saw a picture yesterday. I spoke at Middle Tennessee State University at their entrepreneurship class, and I put a picture on the screen from Dr. Shirley's and my wedding day, and we look like babies.
I have that picture, and we have it in Slack.
Did you really?
Oh yeah,
I didn't know
that. For some reason, we had your pictures at our house when we moved.
Oh, that's right. That is strange.
Very strange.
I didn't know that you liked looking at pictures of me, bedtime stories.
Oh, I just love you so much, brother.
They're in the garage and the dartboard. Yeah. Well, we're talking about age here as a little intro, not only so that I can poke fun at my brother, but because today's episode podcast, we're talking about life stages, not of humans, but of cats. And we have our licensed veterinary technician, Kristal Stanfield, here with us. Kristal, welcome into the Family Pet Podcast.
Hi, thank you.
I have to scoot that mic up there.
Closer to your face. Yeah. Oh boy, she's really looking forward to this episode.
Now, Kristal, is this your first time on the podcast?
It is.
Oh, yay, hooray. I would hit the sound effects, but the applause sound effects not working.
Oh, shucks. And for those not watching on YouTube, Michael's the only one
who's wearing the headphones, so he can tell. I can see that he's pushing buttons and my sound is being distorted for sure, but nobody else
knows.
I would never do such a thing. Mm-hmm. So, Kristal, welcome into the Family Pet Podcast. You are a licensed veterinary medical technician.
I am.
How long have you been in the career?
About 16 years.
Wow.
So quite a while.
Yeah, that's almost as long as I've been married. Just think, when I was getting my picture made, my little baby face, you were in school.
I was.
That's funny.
Yeah. That makes me feel old. Thank you.
You're welcome. Well, we've grown up in this industry together, and we're really glad to have you as a member. You joined Family Pet Health last year.
I did.
About what?
June.
Yeah, almost a year ago.
Yeah, almost.
So we're excited to have you. I'm sad that it's taken us this long to get you on the podcast, but we're glad you're here today to talk a little bit about the life stages. We're actually going to do a 2-part episode. We're going to talk today about cats, and then we'll have you come back on and we'll talk about dogs too. But let's just kind of set the stage for our curious pet parents out there. What are the basic life stages of a cat?
So basic life stages of a cat are going to be your kitten, the adult cat, and then your senior cats.
Okay, that's pretty straightforward.
It is.
Kitten, adult, and senior. Do those feel rather limiting? Do they then break down into further subcategories?
They can. So kittens can break down into subcategories like your neonates, which are firstborn, and then kind of a transition period, and then you have your socialization period, and then your kind of adolescence. So when they're a little bit older, almost to the adult stage.
Okay, and that's basically 1 year, 12 months?
Yeah, so birth to 12 months is the first, up to adult stage.
So that's kittens, and then adults can break down how?
So adults, you have like young adults, and then you have mature adults is what we would call those.
You had the yuppie kittens.
Yes,
the young adults.
Teenagers.
Yuppies? The tweenagers.
Tweenagers.
Anyway, so we have young adults,
mm-hmm.
and then adults. And then we break into senior and what.
So senior
what
would be
happens there?
like mature, and then I think it's I forget the term they used, but it's basically old and then older.
So you have like geriatric.
Senior, yes.
Okay.
Yes.
Okay.
What's when do we consider our feline companions to be seniors?
So usually after 7 years of age, we would say that they were a senior.
Okay, and so less than 12 months,
Mhm.
then 1 to 6 years,
1 to 6 years,
and then seven
plus.
plus, or 6 and a day plus.
Yes.
Okay. Yeah.
And then geriatric. If you broke that, because I mean that's
I think 10 and above is more like geriatric.
and those
at
are
that
I just think of that's an old cat,
You know,
not a senior, but that's an old cat.
But cats can live. I mean, I've seen cats in their 20s.
yeah.
Take care of them.
Yeah.
They will love you for.
Now,
Good genes.
do we have? You just said, like we just broke these down into 3, and we didn't talk about breed specifics.
Mhm.
Whereas in dogs, and probably spoiler alert, we'll probably talk about the differences in breeds.
Mhm.
Do we see a lot of variations in ages when it comes to cats?
I think you can when you're talking about cats that are brachycephalic, so they have the really smushed faces and noses.
Like
They
the
can sometimes
Persian-
have more issues just because their breathing is not great.
Mhm.
And so that can cause some lung issues, shorten, I think, their lifespan a little bit.
Okay.
But I've seen pretty old across the board,
Right.
different breeds.
Well, we have one of our local nonprofits is Feral Hollow Senior Cat
Mhm.
Sanctuary. They have some
20 plus.
Pretty old.
20 old.
Yeah.
We see a lot of them. They're coming in regularly
Yeah.
for Silencia and just pain management and weight checks and things like that.
I
So,
think a lot of it has to do with too of the different breeds of cats. There are some that are more predisposed to certain medical conditions than others. Like we see a lot of Siamese cats that have kidney issues early on.
Mhm.
And so some of those things, if they're more predisposed to things, can shorten lifespan.
That was neat. I did not know. Again,
have you ever been to a cat show?
Have I? What?
Have you ever been to a
Have you
cat
ever seen how
show?
they hold them?
A cat show?
A cat show, like
crazy.
not a dog show, a cat show.
Do cats cooperate for a cat show?
They can.
Yeah.
But they also, there's some really great YouTube videos and TikTok
They-
videos where they
they
did
have
not.
enough.
Yeah, they're like, don't
They're
hold
like,
me
"And
anymore.
we're done."
They're like, there's this one, the cat like starts swatting at the judge, and she's like, I need the owner, please. I need the owner,
I've seen
please.
that one. Yes.
I have
Funny.
the things. My ignorance about cats.
Okay, all you listeners
Once
out there,
again.
here's a little random fun fact that I bet neither of you knew. Dr. Shirley lost her cat at a cat show.
Oh no.
Wait, what?
Dr. Shirley had a cat that she loved, and she took it to a cat show
Oh,
in
no.
Swanee, and it got loose.
Oh no!
But she did get you back. She
Okay.
did get him back. But yeah, Dr. Shirley has entered a cat in a cat show.
Interesting.
They have them. We
Well, I
should
mean,
we should host one here in our garage space.
That would be pure chaos.
just trying.
They're really
Picture cats running everywhere.
yeah. They're yeah. I mean, we should go. We should do a family pet
yeah.
health.
My eyes
live.
would love that.
Oh, that's true. Well, we'll have to put you on some Apoquel before we go.
So
So anyway, just a little sidebar. All you listeners out there, take a moment, pause the show, go and Google cat shows, and cat shows gone wrong. So, but they are not like dog shows. They don't parade them around the ring.
Okay.
But they do groom them and brush them.
Mhm.
But the judges pick them up, and it's not what I would consider super fear-free. The handling techniques, if you went home and tried to do this with your cat, would probably stress them out greatly. So people do work with their cats, but they'll hold them right up underneath their front legs and hold them in the air and twist them to the side, and
They like stretch
and they
them out.
stretch them out. Like they'll put one hand,
Yes.
they'll put one hand under their chest and another at their flank and stretch them out. And the cats, for the most part,
trained and acclimated.
yeah,
will
they're
tolerate
fine
it.
with it.
I'm just trying to think of the normal house cat who doesn't get treated like that on a normal basis. That might end poorly.
What percentage? This is totally off topic here. We've gone off the rails, but what percentage of our feline patients would you say are registered breeds?
Oh, that's a good question.
That would be a fun fact for another
Yeah.
episode. I
mean,
I think about Siamese. We see like specifically people go
Okay.
out and find and buy a Siamese cat
from a Siamese
breeder.
breeder.
Mhm.
And so you
Persians,
have papered,
yes, a registered. So I know that we've seen Siamese and Persian and Maine Coon
Ragdoll.
registered. We do have some ragdolls and
Sphinx.
the Scottish folds. I know we have
Yes.
some of
We
those.
have some Bengals, I think.
We do
or-
have some Bengals. What about are they ragamuffins or something like that?
I have heard those, but I don't
think we have
know
any
if
of
we've
those.
seen any of those.
But
For
yet.
those
The
for those
Nor-
not watching on YouTube, my face.
I want if any of our listeners out there have a Norwegian forest cat,
I've seen pictures of them.
please send us a picture and we will attach your Norwegian forest cat's picture to this podcast episode as the picture for when people search. They're huge. They're like
They are huge.
they're ginormous.
They're like little.
They're
little
bigger
bobcats.
than a Maine Coon.
And
Yeah,
they're
like a
beautiful.
bobcat. Yeah, they're really
They're
cool.
pretty.
I told Dr. Shirley when we don't have any kids, I was going to get her a new cat, a Maine Coon, but maybe a Norwegian forest cat instead. She likes big cats. Okay, back to the show.
Wow, this
Back-
is
We're going to take Stephen to a cat show and we will document that. If you've ever been to a cat show, send us in. Tell us what
tell
we
us.
should look for.
Yes, send
Tell
us
us
the
about your
info
experience.
where we can go to see a cat show.
Yeah.
I am interested.
All right. So
Intrigued.
we've discussed our stages. We broke them down a little bit. What would you? Let's just specifically talk about kittens.
Okay.
Major health concerns or healthcare related things that we need to make sure we touch on for those if we have a cat in the less than 12 month.
I would say the first and most important thing is vaccines and prevention. So we need to make sure we get them started on a vaccine plan, and then also make sure they're started on a flea and tick heartworm prevention as well.
What are your core vaccines that you recommend for our kittens?
So I'd say the FERCP, which is feline rhinotracheitis. I think it's got Khaleesi in there. There's a few other things, upper respiratory type things that are in there as well. When they're old enough, a rabies vaccine. And we also recommend doing at least one feline leukemia vaccine. Just if they're going to be outdoors, they definitely need it every year. But for the first year, at least one of those vaccines and then a booster for that as well.
Even for the indoor.
For the indoor, yeah, just in case if they ever get out. And
So I understand the FERCP, that's respiratory.
Mhm.
Rabies, I understand. Leukemia, I mean, humans, when I hear
you
leukemia,
think cancer.
yeah, that's a
Yeah.
cancer and that's not contagious. So what are we vaccinating with on cat leukemia? What is that process?
So feline leukemia is actually a virus that they can get from outdoor kitties that carry that. They can get it through bite wounds. It's transmitted through saliva. So if they're ones that frequently get into fights or they come in and they have bite wounds, I would always have them tested. It takes about 90 days after a bite wound to show up on a test. So I would say we test it when they come in because it could, especially if they're outdoor, it tests for the previous 90 days. And then that wound will have you come back in another 90 days to retest again to make sure that we're not positive.
And so you said for every kitten, indoor or outdoor, recommend the leukemia and booster.
Right.
And then for cats that are outdoor
Yearly.
going forward, continuing that
Right.
vaccination. Interesting. I
Yeah.
learned something.
There you go.
Are there any extra vaccines that we can give our cats?
That I believe it are the three main vaccines that we give that we have for cats.
Okay.
Yeah.
But those are not all the diseases that can be prevented. So some of the other diseases aren't transferred from cat to cat, but from another vector-borne disease. They're called vector-borne diseases. So something else is infecting our cat. Can you tell us a little bit about this other thing you said, vaccines and prevention? So
prevention, there are several things. One, ticks. Ticks are a big deal with cats because they can get cytox. That is, a lot of people know it as bobcat fever. So a tick gets on a bobcat, they pick up that from the bobcat, gets on one of our house cats if they're outdoors, and can transmit this to them. It's very deadly. So when cats get that, they get very sick. It causes liver failure. It can kill them. So we do recommend keeping them on a prevention monthly.
And I'm just going to interrupt you because people will say, well, my cat never goes outside. We went on our first hike last week, and guess what I brought in on my clothes? Ticks.
Right.
And so even though
just one bite,
all it takes is one bite, we're not fear mongering. We are warning that it really does only take one. Now, did the ticks, I had 3 ticks on me. Did any of those have bobcat fever inside them?
You don't know.
I don't know.
Yeah.
So, but our indoor cats, we have 2 of them, are on flea and tick prevention because we live on a farm. I'm constantly coming in from the outside and may bring in ticks. Also, we have 3 dogs and they go outside every day at 5:30 in the morning. And if we don't let them out, they let us know that it's time to go. And so they go out and run around in our yard, or they were on our hike, and they could bring in ticks into the house too.
Right.
So we did a complete episode on tick-borne diseases.
Episode 74. You can go back and find that with Dr. Michelle Evison.
And even like episode 4 with Zoe. That was a long time ago. But Dr. Evison talked to us about the cytoxoonosis, and it is not a good. It's terrible. It's awful.
Yeah.
It is the worst.
It is.
And we're coming up on that season here that we're going to start seeing those in the office again. So, okay. So that was ticks. What about fleas? What can our...
So fleas definitely can cause a problem in your house. You certainly don't want those in your house because they are very hard to get rid of. It can take upwards of 3 months to get a flea infestation under control once you have an issue. But it also can cause your cat to have tapeworms, which are kind of gross. I mean, they are.
Describe them.
They look like little grains of rice. And you will see them sometimes in cat stool, or you'll see them around the fur area, around the back end. And other than just being gross, it can prevent them from getting enough nutrients because the tapeworm feeds off of that in the intestines. So just making sure that if you see that, we definitely need to test the stool because there could be other parasites as well. But we want to get some medication to get rid of those. But this will help prevent that. Cats are really great groomers. So you may not ever see a flea on your cat, but they groom so well that they get those fleas and they eat them a lot of times, which can cause tapeworms.
And now when the tapeworms come out, are they moving?
Oh, they can be.
Oh yeah, they'll come out of they'll crawl out of the anus.
Oh yeah,
and look around and then go back in.
Yeah, I'm sure they're scoping out the place.
Yep, they're like, yeah, is this where I want to come out?
I could not imagine what that feels like.
I mean, we could. I think humans can get tapeworms.
No, they can.
Yeah, so I mean, we could make that happen if you wanted. We could infect you with some tapeworms.
People often ask how they get tapeworms. But, can your other pets get them? And they can if they're grooming that pet a lot and they ingest a tapeworm, which sounds disgusting, or if they ingest a flea as well, they can get tapeworms that way too.
Because the tapeworm's living inside the flea.
It is.
And then when the flea gets eaten, then the tapeworm comes out.
Correct.
So the moral of the story,
flea and tick prevention.
Prevention.
Yes.
Keep your cat on flea and tick prevention.
Yes. Also heartworm prevention too.
I was just about to say we can't. I would be remiss if I didn't get on my soapbox about heartworms. So
cats can get heartworms. So they are typically self-limiting. So they may not replicate like they do in a dog.
What does that mean? Self-limiting.
So they will die out eventually on their own, I believe. It's just either a female or a male heartworm, and so a lot of times they don't make microflaria, which are the little baby heartworms.
But
it can cause damage.
Right. One heartworm, whether it's breeding or not in a cat, is much more damaging.
It can, because cats, if you think about it, their hearts are much smaller. It can cause heart damage, lung damage, and so you definitely don't want that either.
Okay. So that anything else that we need to be aware of for our kittens? So we start them on their vaccines. We're going to booster them for the big 3. And rabies, by the way, is in Tennessee is by law. You have a law no matter where you are in the state. Your pets are supposed to be vaccinated.
Even if your cat is indoor and you're like, I don't have to. It is by law required.
So don't blame us. But also, we want you. It's fatal, 100%.
Oh yeah, absolutely.
So so rabies, and then FERCP and leukemia.
And it's fatal both to humans and pets.
Correct.
So humans can get
Don't
rabies.
mess with rabies.
Absolutely.
My daughter learned that one.
No maybes with rabies.
Oh yeah, your daughter had a bat in the house.
Had a bat. she had a bat in her room and
Yeah,
was hitting it. And she's like, "Yeah, we got it. We pushed it out or threw it out." And I'm like,
And sometimes they're so small bites.
Yeah,
you
yeah.
don't know that
Yeah,
they've been
this was at
bitten.
Christmas. I freaked out.
Oh no.
we're like, Claire, you have to go get vaccinated
Yes.
tomorrow
Yeah.
when we leave here. What? It's no big deal.
Oh yeah, it's a big deal.
You can't mess around. I will pay for your vaccination. I know it's expensive,
Do you
but
know that
It
most
is
people,
expensive.
most humans in the United States contract rabies from bats?
I'm not surprised
because they don't even
their
they're-
bites are so small.
Yeah, they're in caves hiking
Yeah.
around and the spelunking, and will encounter a bat and don't even know that they've been
Yeah.
bit.
That's another reason
Crazy.
I don't go spelunking. Besides claustrophobia.
That's also a big one. All right, let's move on to our adult cats from the 1 to 6 years. What are we looking for there for healthcare?
So again, you're going to want to make sure that they continue yearly vaccines
Okay.
and prevention.
Mhm.
The other big thing for me is diet and exercise. So cats are notoriously, they sleep, I think, about 16 hours a day. So their diet needs to match their activity level because we don't want them becoming obese. That can kind of cause a lot of other problems. Diabetes puts them at major risk for that. Joint issues, things like that. So we just kind of want them at an ideal weight. And so feeding them the right food, the right amount is really the most important thing.
Okay, and how would we know what the right amount and look and things are?
So most of your bags of food will come with feeding guidelines. And so what you want to feed for is what your ideal weight is for your cat. So if you have a fluffy cat, then you definitely don't want to feed for what your cat weighs right now.
Mhm.
You want to feed for what your ideal weight is. And a lot of times your veterinarian can kind of help you gauge what the best weight would be.
You said fluffy as in overweight. I thought you meant
Yes.
fuzzy.
No,
not furry,
Yeah.
fluffy.
It's a nice way of saying overweight.
Yeah.
If your cat is tubular,
Tubular. That's right. It looks like a sausage.
but
Yes.
no.
And cats are notorious for being a little fluffy.
I will share
Overweight.
that
We gotta use. We
Okay,
don't.
they're
Want,
okay.
we want to be clear. To be clear is to be
Yes.
kind here.
there is a cat in my extended family, Jordan, who is overweight, and he
Yes.
got X-rays on I think
2
it was
weeks
this
ago,
week,
yeah.
last week,
Mhm.
this week. I don't remember when. Yeah, last week, and they called it a fat pouch.
Oh, yes.
Oh yeah, it's
The primordial pouches.
primordial pouch.
Yeah,
His hang down.
Yeah. It's hangy downy.
massive fat pouch.
Yes.
So when you look at him, maybe straight from above, he doesn't look overweight. But when you look at him from the
He's
side,
dragging the ground. Huh?
his belly or
Yeah.
the fat pouch is
Mhm.
really hanging low. So
Well, we
that's not good.
Yeah, and they have 2 cats in their house, so the
Right.
questions become like, are you feeding them together or are you
Mhm.
separating? Because it is a challenge to have multi pet
Yes.
homes. You do have to separate for
Yes.
feeding.
Because you often have one that'll move the other cat out of the way and
Right.
eat all the food. Then you've got one that looks like it's probably a good weight, but it's because it's not getting
It's
to
not
its
getting
food.
food.
The other one's kind of bullying them out of
Yeah.
the way. So we
But
see
then
that sometimes too.
Charlie, the cat in question, is on a weight management food, but still gained weight. And so I'm like,
Given the
Yeah.
fruits.
yeah, they're gonna have to work through that.
Stephen
Right.
just mentioned weight management food. So we do have different food formulations for cats. One thing that I think about is the urinary tract
Mhm.
food. Can you talk a little bit about what is the risk for blockages and things in our male cats? Is that in this stage that we see that a lot?
You can't, yes,
Okay.
the adult stage is mainly where you see that. So it's mainly male cats, but it can happen in female cats too. But their urethra is so small that if a little bit, they get sediment in their bladder, mainly from, just sometimes genetics, but sometimes the food they're eating, the pH in their bladder kind of causes some crystals to form. But that sediment will form and it will get stuck in the urethra, and then they get blocked and they can't urinate, which is terrible because then it starts backing up into the kidneys and can cause kidney failure, kidney damage. So it's really important that if they're blocked, we get them unblocked very quickly.
So we have kidney stones and we have bladder stones, not
Right,
the
we
same
do.
thing.
Not the same thing. So there
Mhm.
are stones that can form up in the kidneys, just some kidney calculi. We can see that sometimes on x-ray. But when they get down to the bladder, when you get stones that form in the bladder, those can also get stuck in the urethra, which can cause, even in dogs, an outflow problem.
And they're huge. They can be huge.
They can be.
Yes.
Like the biggest one I saw was like a golf ball
gravel,
size.
Yes.
gravel size,
Yeah.
large
Yes.
chunks. All right. So
What are the ones that look like spiny balls? Are those?
I feel like those are calcium oxalate.
Okay.
I believe.
I need to.
We won't quote
I may
you
be
on
wrong
that.
on that.
We'll edit. We can hit the edit button here.
But I know
now.
one is smoother and one is more.
I feel like we need
speculated.
to find someone to come on the podcast just to talk about urinary tract and
Okay,
problems
because
in
I've
Oh,
cats.
you could do a whole podcast.
Yeah,
I've
on
got
that.
questions about it, but just to preview, we have. I am familiar with human
Mhm.
kidney stones, bladder stones,
Mhm.
but you're saying crystals
Mhm.
that can block the. So that's
So the
something else
crystals
completely.
are kind of the formation of they start forming stones out of the crystal. So that's like a sediment.
So
that's
even
in
before
there.
they're fully stones,
You
they
can
can
see
block
crystals.
inside the urethra because
Absolutely.
it's
Just the
so
sediment.
thin.
There's so much.
We will.
Yes,
we will
that is
not hold you. We will get us. We need to find a boarded.
I don't know.
I don't know.
Urologist?
Yeah.
We have sorted urologists?
I don't know. We'll find out.
We will
I'm
find
sure
somebody.
you could call around to an emergency clinic. They probably have somebody.
We'll get somebody on here to talk. This is a whole podcast episode.
Oh yeah.
We'll have pictures and everything for the video.
Yes.
Okay. All right. So weight, diet, exercise. We talked a little bit about urinary and tract infections. Any other big ticket things that we see on a regular basis for this adult stage
So
of
I'd
our
say
cats?
probably dental care is a really big
Yes.
issue with cats. We don't see them very often for dentals, but cats do need dentals pretty regularly.
Our most downloaded episodes are the episodes that we have about feline healthcare.
Yes.
Why does that
cat
not?
fans?
But that so you people that are out there listening that love cats, listen to these podcasts. But also at the same time, our compliance, the visits for our cats are down substantially when compared to dogs. We see 80% of our businesses is taking care of dogs, and only 20%. Well, actually, it's like 18% for cats and 2% exotics. Why doesn't that jive? Our feline homes are passionate about their cats, yet that doesn't seem to translate into regular routine care at quite the ratio of our dog owning families.
I feel like for some owners, it's really hard to get their pets here.
Okay.
So the stress of getting them into the carrier at home, getting them into the car, and then getting them here is a lot for a lot of people because they can be notoriously hard to do that. So you go get the carrier, you get it out. Where's your cat? It's gone. It's hiding under the bed because it knows that this is something abnormal. So we try to talk to people about training their cats with their carriers. So keeping the carrier out at all times, keeping the door open so they can kind of go in and out of the carrier. That helps not have so much fear associated with that carrier. And it makes coming to the vet a little bit easier.
As you say this, I'm looking over in the corner.
I'm pointing,
we
sorry.
have our Sleepy Pod. Our friends at Sleepy Pod sent us a cat care. It's a mobile pet bed.
Yes, those are
And
awesome carriers.
We're going to have Sleepy Pod come on the podcast to talk about design, how they design these carriers to encourage cats to see that as a sanctuary.
Yes.
And so it's easier to get them loaded
it's almost,
up.
it looks like a cat bed, basically.
Yep. People
And it
can't
looks
see
really
this,
nice
but
and
we will.
comfortable.
We have a whole
Yeah.
episode on this. So,
And then we have episode 94, which was Mikkel Becker talking about preparing your pet, including
Yes.
your cat, for the transportation of the coming to the visit.
And cats are notoriously quiet when they are not feeling well.
right.
So you don't, often know that, hey, there's something going on with my cat because they hide it very well. Dogs are a little bit more like, oh, they're not eating, they're not acting themselves, they're not wanting to play. Cats, they sleep all the time. So they're like, well, they're still sleeping all the time.
Yeah.
So it's kind of hard to tell when a cat is not feeling well. So often we don't see those signs until it's really advanced.
Okay.
That's good.
So dental care, we want to look at that yearly for this stage. And then what about blood work?
Blood work is really important because during this time, we want to look at internal organs. So a lot of things can change very rapidly, even within a year. So we recommend doing it yearly. What we're looking at is liver values, kidney values. We can often catch kidney disease pretty early. We do have some early renal testing that we can do. So that is very helpful. The other things that can start happening is our thyroid. So cats' thyroids can start overacting. And so it's called hyperthyroidism. So they a lot of times will lose a lot of weight very rapidly. You'll notice that they're eating ravenously, but they're still losing weight. So we see that a lot. So it's really important to get that checked as well. And then we can also check for any diseases like diabetes, which is very common in cats too.
And
Can
also
be.
treatable.
Right.
I didn't know until Dr. Shirley cured her cat of diabetes, but did
Yes.
nothing for me.
Some cats can go into remission.
Yes.
So.
Her cat, remember Bob Dylan?
Yes, I do.
Bob Dylan had diabetes. It was right after we got married. I got diabetes. She fixed the cat. She did not fix me.
She's not a human doctor.
Well, no doctor can fix my
Well,
problems.
because
but
you're
that's
just
okay.
broken.
I know. My pancreas is on
All right.
the fritz.
So we've talked about kittens.
Mhm.
We've talked about adults. Let's talk about seniors.
Yeah.
What specific to seniors are we looking for
Yes.
issues?
So again, vaccines, preventatives, very important.
Your broken record. Vaccines
other-
and
yes.
prevention.
The other, of course, too, with them is diet. I mean, as senior cats, you may need different diet requirements than an adult cat or a kitten. So kittens need a lot of calories when they're young because they're always active. And then as they grow older, they need less of that. But, with diets, some cats who have kidney issues may not need as much protein in their diet. And so it just kind of depends on where they are health-wise, that we might need to change their diet a little bit, especially with obesity. Because as they get older, they're going to have more joint issues. They're going to have osteoarthritis. Those things can happen as they get older, and diets can help with that. So with our weight gain and things like that, it kind of will keep them a little thinner so that they're not putting as much pressure on their joints, which will help with pain. And it can also help just generally with how they feel overall.
Dr. Sam would say the number one factor is going to be weight.
Yes.
Keeping it at a healthy weight.
Yes.
So that's important. But you talked about osteoarthritis.
Mhm.
We've had guests come on and explain that. So that's just the joints, pain in the joints. How do we help our pets there? How do we help our cat there?
So some of that, there are some diets out there that do have glucosamine in them, which will help with joint protection and kind of just making the joints move a little bit easier. The other things we have a really great drug now, which is Solensia. So that does help.
Just an anti-nerve growth
it
factor
is.
monoclonal antibody.
Yes, I'm glad y'all said that. But it does help with the pain associated with osteoarthritis. It doesn't reverse it. It doesn't prevent it, but it does help with that pain because a lot of, times what happens is they get so painful that we're like, I really, their quality of life goes way down because they don't have the mobility they used to. And they notice that their pet is painful a lot. So that does kind of maybe make their quality of life not so great.
Now, Maverick is on supplements for joints. Do cats have supplements? Do cats take supplements? Will they eat it?
Some of them will. So I know there's Dasequin for cats, which I think
that's what Maverick's on for dogs. Okay.
They do have it for cats, and I think it's pretty palatable. Okay. So there are different ones out there that you can definitely use. For
so if you've noticed your cat not jumping up as much onto the countertops or its favorite perch and it's sitting around being more lethargic than normal, those are some signs that
when jumping from the table, instead of jumping from the table straight down, they have to jump onto the chair.
Right.
They're two-staging it.
Yep. Those are some signs that you may see, like, oh, I should talk to my veterinarian about this, and listen to this episode. Go back and listen to it again. Take some notes, and discuss this with your veterinarian, and come up with a good plan for your cat, no matter what stage of life it is in. Kristal, thank you for coming in and joining us on the podcast.
I had fun.
Before we leave, is there anything that we should have asked you about that we didn't?
So I think one of the things I forgot to mention was reproductive health.
Oh, yeah.
Yes. So very important to spay and neuter, especially if you're not a breeder and you're not going to breed. Definitely spay and neuter. Can cut down on the incidences of, for females, cancer. Mammary cancers can cut down on possibility of pyometra, which is a uterine infection that can be deadly. So that's very important. Plus, female cats go into heat and they don't come out until they're bred. So it will be really annoying.
Yes. Is it 2 weeks, every 2 weeks or something? It's like
constant. It's like a cycle.
Because they're whiny,
they're annoying.
Right? Yes. Yes. They never stop.
They rub up against everything. Yep. Their tail is always up. They're always vocal.
Yep. until they get pregnant.
Mate.
Yep.
Okay. Wow.
And that's a whole nother podcast too.
Yes, it is.
That process. That's another YouTube Googling.
Yes.
But
And with males, it cuts down on, spraying,
Mhm.
marking, and then also testicular cancers and that kind of thing too.
I feel like we don't talk about spaying and neutering cats as much as dogs, because if you can't live with either
No,
one
you
in the
cannot.
house. A male tomcat that is spraying,
You can't get that
it
smell out.
smells
It's so bad.
so bad.
Yeah.
And so people were like, I want the cat in the house. It's a
Yeah.
male. It's got to be neutered. So that it's definitely different
we don't
than
have
dogs.
to convince people. They
No.
Correct.
Okay.
Yep.
Okay.
Even just like regular urine in the litter box, I mean, you can smell it. A lot of people, when you walk in the door
Yep.
of the clinic, you'll be like, we have a male cat here.
We have a male
You can
cat here.
tell.
Yep.
Yeah.
And typically those are old barn cats and things like that, or a
Yes.
stray that somebody has picked up and brought in.
Mm-hmm.
So yeah, if you're a cat breeder, most of the breeders, I've only been to one cattery, is what they call them, and it was a detached garage from their house because it smelled so strong.
Mm-hmm.
And they had Maine Coons as well.
Yeah.
So interesting.
Yeah.
out
So I
there.
think the biggest thing too is just to make sure that you're getting those yearly exams,
Mhm.
regardless of the age, because so many things happen: hearing loss, osteoarthritis, all kinds of heart issues, especially with cats. So I think just making sure that you keep up with your yearly exams. When you are a senior, do twice a year exams. So every 6 months for senior cats, sometimes even more if they have a disease process going on. So,
Well, Kristal, thank you so much.
yeah.
The final part of our show is the fun fact that we need you to share.
Okay.
Yes. So we ask you to share a fact with our listeners out there that will help them win trivia night, or at least impress their friends and family at dinner.
Okay.
So,
well,
Kristal,
I've got
what is your
two,
fun fact?
Actually.
2.
Yeah.
All right.
I overprepared.
There you go. That's why we hired you.
So,
All right. Lay us on. What's the first one?
So the first one, it actually goes along with the preventative stuff. But did you know that fleas can jump over 350 times their body length? Which
That's
is
pretty
crazy.
impressive.
That makes me itchy.
Up or out? High or out?
I think out.
Oh, wow.
Yeah.
A 45-degree angle to maximize the distance.
Can you imagine? That would
So
be pretty
that-
cool to have that power.
Yes. But that shows how quickly fleas can spread. So from patient to patient, or, outside from dog to
Yep.
grass to dog,
Oh, man.
that kind of thing. And then the other cool thing is ticks start spreading disease after 24 to 48 hours.
Tell us
of
what you
being
mean by
attached.
that. Okay.
So ticks can carry diseases: Lyme disease,
Mhm.
anaplasmosis, Ehrlichia. There's all kinds of different tick diseases out there. So once they attach and start taking a meal, they can transmit those diseases within 24 to 48 hours of attachment. So they have to be attached for that amount of time to transmit
Before,
those.
yep.
Yes.
And that's
So a
why
lot of our fleas and ticks, the preventions start killing at 8 hours or more, 8 hours at least. And so they start killing them before they can transmit those diseases.
Good to know.
Yeah.
The tick I had on me, I got it off before I'm at risk of contracting
Right.
the meat disease,
Oh,
the
that would be
meat
awful.
allergy, alpha gal.
That'd be
Oh,
awful.
Michael
I will be
no allergic to meat.
I will be so sad. So, well, Kristal, thanks for joining this episode of the Family Pet Podcast. We appreciate you being a part of our team and bringing your knowledge to share with our curious pet parents out there. If you enjoyed this episode, especially if you know someone out there that has a cat as a part of their family, share this episode with them and make sure that they are following all of Kristal's advice today. There may be some information here that'll give them extra time, quality time with their cat. We hope you've enjoyed this episode, and until next time, stay curious.